How's it going today, everybody?
Good!
That's nice to know. Okay, we have a very special guest today. His name is Dr. Case. Please welcome Dr. Case.
Introducing Dr. Case! Dr. Case! Dr. Case! Where's Dr.
AJ!
Dr. Case, get out of here! Go!
Oh, I'm sorry, guys.
Yeah,
Sorry,
Dr.
everybody.
Case!
Oh, you're okay, Dr. Case?
I'm okay.
Oh, you're good. Okay.
That was traumatic.
Well, hello, everybody. How's it going today, Dr. Case?
It's going well.
Going well. Going well. Okay. Oh yeah,
That was something.
Table came out of nowhere. Okay, so today we're going to be talking about a very important subject. This subject is PTSD, also known as post-traumatic stress disorder. Okay, can you tell us a little bit about PTSD, Dr. Case?
So PTSD is one of those disorders that come after something that happens in your life. It could be a traumatic event. It could just be from prolonged abuse or stuff like that. These things happen. Could be how you work, something that happened at work accident, stuff like that.
Damn work. So is there any certain risk factors of this disorder?
Certainly. As with most conditions, there are risk factors like traumatic events, accidents, stuff like that. If you're, say, a soldier, you join the military, you go to war, PTSD can come from those sort of things.
Interesting.
Yeah.
Is there different types of this disorder? Different stages?
There
maybe?
are different stages. Some people experience acute PTSD, where symptoms only last about 3 months, less than 3 months. Others have like chronic PTSD, which is obviously a lot longer lasting. There's also delayed onset PTSD. Symptoms don't appear until months or years later. That's that type of thing. But lastly, there's complex PTSD. It's also called CPTSD. It comes from repeated trauma, so abuse, neglect, stuff like that.
What symptoms happen to be associated with PTSD?
Well, symptoms can be like you can have flashbacks. Just witnessing events can bring back.
And that's gotta have take a toll on your daily life, doesn't it?
Absolutely.
Okay. Are there any certain complications of this disorder?
If it goes untreated, it can cause other disorders like chronic depression, substance abuse, suicidal thoughts. And constant stress does affect the body. So that can be an issue with PTSD.
So you're a doctor, right? So how do doctors diagnose someone having PTSD?
Well, a mental health professional, such as myself, or psychologist, psychiatrist, they have to make the diagnosis, usually by talking to the person, comparing symptoms. It can take at least a month.
Oh, diagnose.
Symptoms typically have to last about a month for it to count as PTSD.
Otherwise, what would it just be like? Trauma?
It would just be
like
trauma,
that?
yeah.
What is the prognosis of this disorder?
The prognosis is typically very positive because with the right treatments, talking to certain people, stuff like that can lead you on the right track.
What are some common treatments that you can get for having PTSD?
The most common therapies, such as cognitive behavioral therapy. Okay, they're like anxiety medications, those type of things, mood stabilizers, stuff like that.
Yeah, is there anything that can be done to prevent this disorder or reduce the chances of it developing?
There aren't guaranteed ways to stop it from developing, but early support after a traumatic event can help.
Why does awareness of this disorder matter?
Why does awareness matter? If people with the disorder don't feel welcomed into society, awareness, if people knew the disorder was real, as long as they know that, they can feel accepted.
Yeah, that makes sense. Do you yourself know of any notable famous people?
There are a few. I know Lady Gaga has PTSD. Prince Harry after his military experiences. And Ariana Grande has PTSD. Yeah.
Very famous people. Well, thank you, Dr. Case. It was a pleasure to meet you. Pleasure to meet you. Thank you for coming on the show. Thank you.
Yeah, it's Dr. Case! Learn and win, people!
Okay, now everybody, we have another very special guest. He is a victim of PTSD. He has suffered the very traumatic experiences in his life. Everyone, please welcome Mr. Hemming.
Yeah, Mr. Hemming.
There's the seat, Mr. Hemming.
Yeah.
So, Mr. Hemming, please tell us about your experience with post-traumatic stress disorder.
So it was last year. I was in Spanish class, and
Okay, so tell us about your experience. All right, go ahead.
fine. So I was a freshman in high school, and I was in Spanish class, right? And then what happened after that? Sorry, it's just, you know.
Yeah, it's okay. Breathe through
It's
it.
difficult to remember. It's difficult to remember. Okay, sorry. We were in Spanish class, and then this guy, I forgot his name, to be honest. I disowned him after, you know. So he pulled a key out, right? He was like, "Oh, I keeped someone earlier. You know, their skin didn't cut or anything. I was interested, and I told him we probably shouldn't be keying people, right?" And he's like, "I'm gonna key you," and then my other friend, who was actually my cousin, he was like, "No." He was like, key him. And he was like, "Oh no, I won't." I trusted him. And then a few seconds later, he keyed me right there! It hurt. It hurt so bad. And then, it's all blackout blur after, I don't know. I was so scared.
Oh, it's okay. Mr. Hemming, please don't cry. Everything's gonna be okay, right? Do you have any notable marks from this traumatic experience?
I already showed you my mark.
Can we see it?
I literally just pulled my arm out.
We didn't see it. Show the camera.
Dr. Wu.
Show the camera.
Where?
So do you have any experience with keys lately, or did you switch to key cards to get into your house, or do you still use a house key?
I just own them, to be honest. I just kind of, if there's a key, I just kind of I use a lockpick, you know.
So you say you're scared of keys? Okay. Well, we actually have something here for you today. Bring out the key!
Ah!